Welcome to Care University. You know, the area of high blood pressure or hypertension is so very important. A majority of people don't know they have high blood pressure, and this condition causes enormous wear and tear on our body that can result in cardiac damage, damage to our heart and our cardiovascular system, the brain when we can have stroke, and even kidney damage. So there's much you can do to reduce the harm of high blood pressure if you have it. We organize our learning about how to keep healthy and how to treat the heart and circulatory system using the 5 rights of cardiac care. The right tests, the right diagnosis, the right treatment, the right monitoring of treatment, and the right prevention when we're back to health and we want to focus on staying healthy for the rest of our lives. We will come back to the 5 rights a little later, but first we'll need to understand what is called the cardiocirculatory system, or the heart and blood vessels. Your heart and circulatory system of blood vessels are amazing in the work they do for you every single day. Let's start with the heart. Your heart is a muscular organ about the size of your fist and is located slightly left of center in your chest. Your heart is divided into the right and left side. The left side of the heart pumps oxygen-rich blood to the body, and the right side pumps blood through your lungs, which absorb the oxygen from the air you breathe. Together, your heart and blood vessels comprise your cardiovascular system, which circulates blood and oxygen around the body. In fact, your heart pumps about 5 quarts of blood every single minute and beats about 100,000 times in one day. That's about 35 million times in a year. A beating heart contracts and relaxes with a regular rhythm. When the large muscular chambers, called ventricles, contract, they force blood into the vessels going into your lungs and body, much like blowing into a balloon. Your ventricles then relax and are filled with blood coming in from the upper chambers. Then the cycle starts all over again. So now let's discuss the 5 rights of cardiac care for high blood pressure, or what is also known as hypertension. First, high blood pressure is a common condition in which the long-term force of the blood against your artery walls is high enough that it may eventually cause health problems such as heart disease, stroke, or even kidney damage. Blood pressure is determined both by the amount of blood your heart pumps and the amount of resistance to the blood flow in your arteries. The more blood your heart pumps and the more narrow your arteries, the higher your blood pressure. Normally, blood pressure is recorded by 2 numbers said together, such as 120/80, which means the pressure measured in the arm when the heart beats is 120, and the lower number, 80, is when the heart relaxes. Elevation of these numbers over certain standards means one has high blood pressure. So the pressure is determined by the amount the heart pumps and the resistance of your arteries to that blood flow. The resistance to the blood flow is affected by 3 factors. How flexible are your arteries, how wide or narrow are your arteries, and the thickness of your blood. If it's thicker and carrying more fat or protein, then your blood pressure is higher. High blood pressure is called the silent killer because people typically do not have symptoms and do not know they have it, and yet it can cause wear and tear on the body that can lead to heart attack, stroke, or even kidney damage. So the first right are the right tests. Your blood pressure is typically measured by a blood pressure cuff by a professional caregiver listening to or measuring the pressure from a heartbeat and when the heart relaxes. Next is making the right diagnosis of hypertension. Although most adults have high blood pressure without special factors, some issues like emergency symptoms, pregnancy, or very high pressures might require special actions. When patients are first seen, their blood pressures are taken 30 minutes after activities that may raise one's pressure. A medical history is taken, and other tests such as checking the urine and evaluating for other diseases, such as checking for diabetes, may be undertaken. Next is the right treatment. Once the grade or level of hypertension is identified, patients typically will be recommended to undertake certain lifestyle changes. The most impactful is weight loss. Exercise and certain healthy diets such as the DASH diet, Mediterranean diet, or Daniel Plan diet will be recommended. Salt restriction and alcohol restriction are also often advised. These all work together to reduce blood pressure. Medications are recommended in a stepwise fashion with doses and additional medicines added until the proper blood pressure is achieved. Next is the right monitoring of the treatment. It is critical to remain with your caregiver who will check your blood pressure in follow-up visits in order to get you on the best long-term plan. Finally, the right long-term prevention and surveillance plan of high blood pressure is critical. It is so very important that you keep your medication list up to date, refill your medications, and have your blood pressure regularly checked and check it yourself. So now that you've learned about the 5 rights of high blood pressure care and the importance of the right tests, the right diagnosis, right treatment, right monitoring of treatment, and right prevention, what can you do after you watch this module to protect you and your family? The care and prevention of high blood pressure is really about the mind, body, and the spirit, like so many of our chronic illnesses. Integrative care is the concept of a whole person approach to health that ties these 3 together, especially now that we understand that stress reduction can help lower blood pressure. When families can align the most positive forces, they really can have terrific impact. Your takeaway can be remembered by the 5 rights checklist. The checklist can be on paper, which you can download and print, received from your caregiver during a visit, or easily used on our smartphone application, which walks you through each of the 5 rights. The right tests. We need to make sure our families and friends are aware of the silent killer and to get their blood pressure checked, and other tests that their caregiver may recommend. The right diagnosis. Your caregiver will make a diagnosis as to the severity or level of your high blood pressure, and it's important that there are no special causes, emergency symptoms, or need for special actions. Right treatment. You need to be accountable to do your part to focus on lifestyle changes that can reduce stress, adopt a good diet you can live with, and exercise to lose weight if recommended. Take medications properly and follow your caregiver's instructions. Whole person treatment is mind, body, and spirit. Lifestyle and stress reduction treats the mind, medicines and weight loss treats the body, and having faith in your caregivers and their approach is spirit. Right monitoring. As you begin your course of treatment, you need to make sure to keep all visits and have your blood pressure checked as frequently as you've been asked. Stay with your care plan and get your blood pressure in the optimal range. Keep good records of your progress and make sure your caregiver knows if there are any new changes or treatments that you receive. Right prevention. The impact of uncontrolled high blood pressure is very important and is a silent killer. It is key that you keep follow-up visits, have your blood pressure taken regularly, report on new changes even if you think your blood pressure is in control, and stick with your long-term plan. So now we know that we can really prevent an awful lot of wear and tear on our bodies when we focus on the mind, body, spirit approach. This is absolutely critical, and I think we can have an enormous impact on prevention. God bless you in the future, and we wish you the best. There are other Care University modules that may be of benefit to you on your healthcare journey ahead. These include helping you understand how to measure your blood pressure, manage your medications, maintain your medical records, and give you more detail on cardiac care and introductions to the various diets you may consider.